Yeah, let's discuss an interesting topic today. I'll be talking about something in medicine we call cesarean scar ectopic pregnancy. What is a cesarean scar ectopic pregnancy? It's a pregnancy which occurs at the cesarean scar within the myometrium or within the wall of the uterus. Of course, we know what a cesarean scar is. Once when they are removing the baby during birth through cesarean section, the scar that remains is what we are calling and then the pregnancy forms there is what we are calling a cesarean scar ectopic pregnancy. This is one of the most life-threatening pregnancy. It's one of the most is a life-threatening gestation. Of course, some of the symptoms when you have this will include pain, low abdominal pain, especially early in pregnancy, and maybe sometimes spotting or light bleeding. Sometimes maybe you might not see any symptoms early in pregnancy. But what we normally do is we encourage mothers, of course, those who have gone through cesarean section in the previous birth. We encourage them that immediately when you conceive during the first 2 months, let's have a scan done. Of course, what you're saying is the main or the best way of diagnosing this will be through a transvaginal scan. So my plea is, once you conceive and you know you have had a cesarean section, let's do this scan just to ascertain that that pregnancy is in the right place, is within the endometrium, so that at least we can continue the pregnancy to term. Of course, I said this is a life-threatening pregnancy, because if it's not handled, if it's not dealt with early, if it's not treated early, then we might end up losing your life, or we might end up losing even the uterus, and that will cause, of course, infertility in the future, in your future life. So kindly, once you conceive, once you know that you're pregnant, let's take it out to make sure that it's not a cesarean scar ectopic pregnancy. Once again, I've always said we share information to enlighten people, not to cause any fear, but just to enlighten the society, so that you don't lose people because of simple things that could be handled early. Sonographers and those doing imaging outside there, kindly be on the lookout. When you're doing ultrasound, just make sure, especially on mothers who have had cesarean section in early pregnancy, make sure that we are not dealing with a cesarean section scar ectopic pregnancy. Thank you, and have a great day ahead.